Polycystic ovary syndrome and infertility. Polycystic ovary syndrome is due to hyperandrogenism. It is a syndrome of ovulation disorders accompanied by lipid metabolism disorders. It is an endocrine disorder. The true cause is the presence of ovarian stroma with interstitial cells of the testis. Therefore, it is associated with hyperandrogenism. The fundamental cause is a gonadal dysgenesis of the ovaries. During development, male cells that should have regressed do not disappear completely, and this type of ovary is called an ovotestis. The ovotestis tissue on the ovary must be removed. Treatment involves removing the interstitial cells of the testis through laparoscopic surgery. This procedure is called ovotestis ablation. The main characteristic of this procedure is that it requires fluorescence tracking. The cells that can secrete androgens are located and removed. The main symptom of polycystic ovary syndrome is irregular menstruation. The menstrual cycle is prolonged and delayed. Hyperandrogenism is also present. Ultrasound shows the development of multiple follicles, although not all may be visible. Diagnosis must be carefully considered. A diagnosis of polycystic ovary syndrome does not necessarily mean it can be cured. It must be subtyped. There are 13 clinical subtypes of polycystic ovary syndrome. For example, it is often accompanied by uterine malformations, including septate uterus, infantile uterus, cervical incompetence, and asymmetry of the uterine cavity. There are also 13 subtypes of PCOS that are associated with type 2 diabetes, especially obesity. Different treatments are needed for different subtypes. The basic surgical treatment is ovarian drilling. Other adjuvant surgeries. Different procedures are performed according to different accompanying conditions. For example, corrective surgery is needed for uterine malformations. Cervical incompetence can be treated with cervical circlage. Hysteroscopic metroplasty can be performed for septate uterus. Uterine enlargement surgery can be performed for infantile uterus, and so on. If type 2 diabetes and obesity are present, gastric correction surgery may also be necessary. This goes beyond the reproductive system, as surgery may also be needed for the stomach. If the surgery is performed properly and ovarian drilling is done, menstruation will become regular and pregnancy is possible. Removing other accompanying conditions will prevent miscarriage, biochemical pregnancy, ectopic pregnancy, and other complications. This can ensure a successful pregnancy. This is ovarian drilling performed under the promise of medical care at Beijing Antai Hospital.